Let's go. Let's get jumping in here. We're gonna do some NCLEX questions. Boards. Boom. Shakalaka. Yeah. What's up, Tiggy? Wait for a few more people. We've got 4 minutes. I just jump on a little bit early just to let some people get in here. Yep, this is a crown on my head. Today was my daughter's birthday, and we did a princess party. What do you think, guys? Princess party. Boom. Went out to dinner. Everybody wore princess hats. Went to took a bunch of 13-year-olds to a sushi restaurant, and everybody had to wear a princess crown. I was for it. I'm not above that. So I was like, hell yeah. I will stand at the door of the restaurant. I will greet everybody as they come in. Every kid, I'm going to walk you to your table with the princess hat on because I'm a girl dad. And that's how I roll, right? Any other parents out there with some teenagers or some new teenagers? My daughter just turned 13 today. Crazy, crazy, crazy. We got 3 minutes before we kick this off. 3 minutes. I was like, am I on the right live? Yes, you're on the right live. You're... I see you, Chris. Referencing, yes, my military days. You know, went from gung-ho, badass, military guy, and now I'm wearing princess crowns for my daughter. Hey man, it's all love. It's all love, baby. All right. I don't know where to go for prereqs and get info on where to start. I'm assuming you're talking about nursing school there. Look at the nursing schools around you. That would be in your proximity to go to, and jump on their webpage. Every school's got their list of what criteria is needed from you in order to be accepted. All right. We got a few people in here. It is 9:28. Just a couple housekeeping things as more people are jumping in. I'm Nurse Jimmy. I'm an ER nurse, and we are doing NCLEX study questions. This is great for the NCLEX. It's also great if you're just in nursing school because we're going over questions that very likely could show up on a test. These are mixed subject questions, and we're going to be doing 60 of them. And you're going to find a few things in the link in my bio. I have this on the board right here. I need to correct that. It's 25. I do custom NCLEX study plans. They take everything about you into consideration, and I build you a custom study plan based on your responses. So your time available, your access to resources and software, the amount of time you have to study during the weekdays, weekends, whatever. If you're a repeat test taker, your CPR. All right. So I take all that into account. And so that is $25. I have a free resource, and that's my NCLEX Vault, also in the link in my bio, about 240 pages of cheat sheets. There's a mini test after each question. After each section that basically chronicles every subject you're going to encounter on the NCLEX. All right, that being said, boom, it is 9:30. It is time to begin with all the questions that you are here for. So, you don't want to see pictures of my daughter's birthday. So let's go. Question number 1. Here we are, guys. Oh, and I need to do a little quality control here. Hold on a sec. Okay. All right. I mean, Sarah, the questions are very similar. All right. Yep. Thank you for those follows. If you guys haven't followed, go ahead and follow. Go ahead and share this live so we can get more people in here. All right. We're going to be doing this every single night this week. 60 questions at least. Okay. Every night. Drop your answers in the chat. Let's go. Client with DKA receiving an insulin drip. The nurse notes potassium level 3.1. What is the priority action? Okay. What's the priority action? All right, seeing lots of C's. All right, A. All right, potassium of 3.1. All right, here, guys, the answer here is going to be C. C is correct because insulin drives potassium into the cells and will worsen hypokalemia. Okay, so increasing when that hypokalemia is increasing, that increases the risk of fatal arrhythmia. So potassium needs to be replaced before continuing the insulin. All right, let's jump into question 2. These first 10 are just to get the brain warm, guys, okay? They shouldn't be all that complicated, but hey, it's nursing. Shit can be complicated. Let's go. Client with chest trauma suddenly develops tracheal deviation to the left, absent breath sounds on the right, and severe dyspnea. What's the nurse's priority? What is the nurse's priority? All right, C and D, B. All right, thank you, Wanda, for the gifts. All right, lots of D's here. What is the nurse's priority, guys? Think, okay. All right, so here, the answer here is going to be B, prepare for needle decompression. All right, because what these signs and symptoms of indicate a possible tension pneumothorax. So that treatment is always, the immediate treatment is always going to be needle decompression. All right, not diagnostic testing. So when you see these questions, what's the priority? Think to yourself, if I had to do one thing, if I had to do one of these answers and then walk out the room and never come back, which is going to help the patient, all right, the most? All right, question 3. So, client with heart failure is receiving furosemide. Which finding requires immediate intervention? All right. Seeing lots of C's, right, guys, because furosemide or Lasix is not a potassium-sparing diuretic. So people are constantly losing potassium, so we need to keep an eye on that and trend it. So that potassium 2.9 is low, leading to risk of increasing arrhythmias. Thank you, Fiona. Appreciate that. And hopefully, Fiona, you saw the study plan I sent you. It is in your email inbox. If you have looked at it, go ahead and you can drop a comment in the chat on kind of how complete and thorough that study plan is. All right. So, question 4. All right. A postpartum client reports sudden severe headache, visual changes, and epigastric pain. Blood pressure is 170 over 112. What is the priority? What's your priority here, guys? Lots of A's, a C. Yeah, guys. All right. So correct answer here is going to be A, administer mag sulfate. So we're going to do this because this is severe preeclampsia with a high seizure risk. So here mag sulfate is going to be the priority. All right. Question 5. Here we go. Client with chronic kidney disease has a potassium of 6.4, peak T waves and confusion. What should the nurse do first? What should the nurse do first? Thank you guys for the follows. If you guys haven't already, go ahead and follow. Go ahead and share this live. Let's get some more people in here. We got 175. We're trying to get at least over 500. Let's go. All right, going to 60 questions, guys. All right, question 5. Here, I see some B's, some D's. All right, our priority here. What should the nurse do first? Here is B, give IV calcium gluconate. So B is correct because calcium gluconate will stabilize the myocardium immediately. And why is that important? Well, when your potassium 6.4, that's out of range. 3.5 to 5 is the range, right? Right. So you need to stabilize that myocardium, preventing any lethal arrhythmias. Answer is B. Okay. Question number 6. There we go. Oh, it's a SATA question, guys. All right. Your favorite. You guys were asking me for these in the previous lives. All right. A client with suspected meningitis is admitted. Which actions should the nurse perform immediately? All right. Let's see it. Let's go. All right, I see some A, B, C, and D, A, B, C, and E, A, C, E, a lot of A, B, C, and D. All right, so I'm not sure I saw anybody with the correct combination here. B, C, and D, A, B, C, and D. All right. So, guys, the correct answer here is going to be A, B, and D. Okay? So, A is going to prevent transmission. B must be started quickly to reduce mortality. Okay? And D, those blood cultures should be drawn before antibiotics when possible. All right? With C, C should not delay treatment. E is unsafe. Antibiotics should never be delayed for the LP. Okay. All right. The SATA questions are a biznatch. All right, 7. Here we go. Child with suspected epiglottitis arrives drooling, leaning forward. What should the nurse do first? Okay. All right. You guys are killing it. Not the child, though. It. This question. SATA does kick everyone's ass every time. Okay. So the question here, so the answer here is going to be C. All right, prepare for possible intubation. So that, this sounds like airway obstruction is imminent. All right. All right, question 8. A client with COPD is receiving 4 liters nasal cannula oxygen and becomes lethargic. ABG has a pH of 7.28, a PaCO2 of 74, a PaO2 of 58. What is the priority? Okay. Some B's, C's. B's, 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 C, D. Okay, so guys, here the answer is going to be B, right? Because severe hypercapnia, all right, requires that ventilatory support, all right? That positive pressure is going to help that hypercapnia, that high CO2. Okay, thank you guys for the follows. You guys are incredible. All right, let's go to question 9. All right, a client on a heparin drip for a DVT has a PTT of 158 seconds. What is the priority? What is the priority? All right, seeing lots of A's. You guys are on top of it. Yep. So we are going to stop that transfusion, okay, because that level is dangerously high and the infusion should be stopped immediately. All right, hard stop. All right. Good, XOXO, you've been studying? Hell yeah. It's all right. These questions are challenging. That's why we're all here. That's why you're taking time out of your day to do these. All right. Question 10, another SATA. All right, guys, think when you see these SATAs, try not to let them freak you out. Read each answer as its own true, false question, okay? If it's true, great, check it off. If it's false, kick it out, okay? All right. Which statements show correct understanding? Let's go. All right, C, B, C, B, C, A, B, C, and E. Okay, so right here, the answers are going to be A, B, C, and E. Okay, so A is correct because vitamin K consistency does stabilize INR. All right, we don't want too much, but enough is consistent. Consistent is fine. That's the key word there. All right, B, decreases bleeding risk. C is required for dosing, and E reduces trauma and bleeding. All right, D is dangerous and just wrong. Okay. All right. Question. Oh, let me pause for a second. I do this after every 10 questions, guys, just to fill you in. If you're new here, I'm Nurse Jimmy. I'm an ER nurse, and I'm going to help you pass this motherfucking test, okay? Because it's hard. It sucks. Preparing for it sucks. I know. I took it twice. So if you haven't already, go ahead and follow, okay? Step number 1, go ahead and follow. Go ahead and share this live and throw a couple likes on the screen. Okay. Thank you guys for doing that. In the link in my bio, you're going to find 2 things. One of the services I provide is custom NCLEX study plans based on you, your resources, your time, your weaknesses. If you're a repeat test taker, they are based on your CPR. All right. To shore up those, to shore up your weaknesses. There's a couple people in the chat in this live who I've provided study plans for. They can attest. All right. That's available. They're $25 just because they are individualized and it takes me some time to do it, but I usually turn them around within 24 to 48 hours of the request. Okay. Also in the link in my bio is the NCLEX Vault, 240 pages, free, 240 pages of cheat sheets, mini tests after each section, and strategy guide on how to attack this test. All right. So that is it. Let's do the next 10 questions. What do you say? And if you guys haven't already, go ahead and share this live for me. Doesn't hurt you at all. Only benefits us and gets more people in here. All right. Question 11. Here we go. A client with a pulmonary embolism suddenly becomes hypotensive and tachycardic. What is the nurse's priority? I'm going to be doing live. I'm going to be doing lives every single freaking day this week, Sunday to Saturday, including Thanksgiving. Okay, because I'm here for you. All right, I'm freaking here for you, guys. What is the nurse's priority? The priority. If you had to do, when you see the word priority, I want you to think, if I had to do one of these answers, leave the room and never come back, which one is going to help the patient? Any answer changes? Oh, Lord. All right. Jennifer, I saw you with it. Okay. Okay. We are going to give we are going to be preparing to administer alteplase, okay? Because that is the next step here. I get what you're saying, but B is correct here because we're talking about sudden hypotensive and tachycardia, okay? This suggests a massive PE, and thrombolytics are going to be a life-saving intervention, okay? Elevating the head of the bed is great, but if you walk out of that room and never come back, they're still going to die, okay? For D, you can apply oxygen, and sure, that might help, but it's not going to resolve the obstruction that is happening in their body. Okay, there is somebody asked about PN stuff. Some of these questions do apply to PNs. You're obviously not going to be dealing with like unstable patients, but there will be fundamentals and stuff in here. All right, thank you, Cam, for the follows. All right, here we go. Question 12. Client, pancreatitis, has sudden worsening abdominal pain radiating to the back, hypotension and bruising around the flanks. What should the nurse do first? What should the nurse do first? What should the patient is hypotensive, okay? What should the nurse do first? They're hypotensive. I'm seeing a few more right answers. Right. The answer here is B, prepare for urgent fluid resuscitation. Okay. What should they do first? An NG tube is not going to help their blood pressure. Morphine decreases blood pressure, helps with pain, but decreases blood pressure. And placed in a semi-Fowler's position, okay, well, it's supportive, but insufficient. Okay. The most correct answer here is B. 13, client on, a farm question. Reports severe headache after eating aged cheese. BP 214/120, what is the priority? What is the priority, ladies and gentlemen? Okay, bonus points. Does anybody know what type of medication phenelzine is? Anybody? A is the correct answer. It is an MAOI. You guys are motherfucking on it. Let's go. Let's go. Hell yeah. All right, because we need to treat that hypertensive crisis related to MAOIs. All right? B doesn't do it. C doesn't address the emergency, and D offers zero fucking benefit whatsoever. All right? 14. There we go. Client with septic shock is receiving norepi. Which finding requires immediate intervention? Immediate intervention. Okay. Rarely do we ever have to immediately address urine output. I'll tell you that. Okay. Here, guys, the answer is going to be C, cold and mottled fingers. All right. So C indicates impaired perfusion from vasoconstriction, but it also could be due to extravasation, okay, which we need to be really careful with norepi, all right, or Levophed. You probably heard it called that as well, all right. So we had a question on the last live about the red streak sometimes is indicative of extravasation with norepi, okay? Yep, Isabel, more than 30 mLs of urine an hour is good. All right, 15. Pediatric client with Kawasaki disease is receiving IVIG. Which finding requires immediate attention? Which finding requires immediate attention? All right, great, guys. Seeing lots of C's. Fantastic. Because C suggests that there is some sort of coronary artery involvement. Okay. A and B are common, and D is expected in the acute phase. All right. 16. Here we go. Client with a total thyroidectomy reports tingling around the mouth and muscle twitching. What should the nurse do first? What should the nurse do first? Okay. Some A's, some B's. All right. Yep, A. You're going to administer calcium gluconate, right? Because A treats hypocalcemia from parathyroid injury. Okay? B and C are secondary, and D does not address that underlying issue. All right, 17. A client with cirrhosis has ascites, confusion, and asterixis. What is the priority? What is the priority here? Some B's, some D's. Okay. Good job, guys. Yep, here answer is going to be B. All right, B here treats the hepatic encephalopathy that the question is alluding to. All right, and that it does that by lowering the ammonia level. A helps ascites, but not confusion. C is for comfort only. D affects clotting, but not mental status. Okay. I'm going to be doing Wheezy Baby 4121. I'm going to be doing these lives every day this week, Sunday to Saturday, including Thanksgiving. Hit that follow button. I'll be posting it in my story. You can register for the lives there, okay? So that TikTok sends you a reminder. Guys, thank you for all the follows. Yes, if you haven't already, let's go. Let's go. Hell yeah. All right. Thank you guys for all the follows. Much love. You guys are the reason I'm here. We're going to pass this fucking test. All right. 18. A postoperative client has a rigid abdomen, fever, and tachycardia. Which action is the priority? Which action is the priority? All right. This is for mainly RN, but there will be some PN overlap when we talk about fundamentals and things like that. Okay. 18, it's going to be, correct answer here is going to be C. I see lots of C's. Fantastic, guys. You guys are killing it. Because C here indicates a suspected perforation or peritonitis, which requires immediate cervical evaluation, okay? A helps, but isn't the priority. B isn't essential. And D just masks symptoms, okay? That was 18. Let's go 19. All right, a client on warfarin has an INR of 9.2 with no bleeding. What is the nurse's first action? Whoa, we got to know our INR levels. Okay. What is the nurse's first action? I could make, so I've got the answer is A. All right. So because A is going to immediately start lowering the dangerously high INR. Okay. B alone is insufficient. Okay. Again, if you just do the one thing and walk away, which is going to help or hurt the patient, okay, your INR is still high if you stop it. If you stop the warfarin, you need to reverse it, okay? You need to reserve it. So you need to lower that dangerously high INR. C is for active bleeding. D is just unsafe. Don't do that. All right. Here we go. Question 20. A client in diabetic ketoacidosis has small respirations. What is the nurse's priority intervention? After this question, we're going to just stop for 20 seconds. I'm going to tell you just real briefly a little bit about me for the 200 plus that have joined since the last 10 questions. All right, what's the answer here, guys? I see A's, B's, D's. All right, the priority intervention here is going to be A. Okay, so doing the insulin fixes the acidosis by stopping ketone production. B is rarely used, C is unnecessary, and D does not address the cause. Okay? Great job, guys. Hey, we've got over 400 people in here, which means it's about 170, 180 new people since question 10. I'm Nurse Jimmy. I'm an ER nurse, and I'm going to help you pass this test. Okay, guys? So if you haven't already, go ahead and follow. We're going to be doing these lives every single day this week, Sunday to Saturday, including Thanksgiving, because other creators are taking the holidays off. I'm not, and I know you're not, because you're studying for this test, and you're going to study every freaking day. All right? So thank you guys for all of these follows. Fantastic. 2 things. If you guys are taking the NCLEX soon, 2 weeks or more out, the link in my bio, you will be able to request a custom NCLEX study plan. All right. They are $25. I'll tell you that because it takes me time to do it. I usually turn around in 24 to 48 hours, but they're based on you, your life, your time, your resources, your subscriptions that you have access to, and your weaknesses. If you're a repeat test taker, it's based on your CPR, okay, to shore up those weak areas. So there's that. And then also in the link in my bio is the NCLEX Vault. All it asks for is your email address. Otherwise, it's totally free. 240 pages of cheat sheets. All right. And study questions, study quizzes after each section. All right. Oh, we're from Ghana. We're across the Atlantic. Oh my gosh. Where else are you guys from? Drop it in the chat. How far across the world are we? Canada, Jamaica, the Bahamas, Ghana. Oh my gosh, you guys are freaking awesome. Texas, what's up? Trinidad and Tobago. All right. Well, hey, I'm in the Southeast. I'm in North Carolina. So all my lives are going to be Eastern Standard Time. Illinois, Quebec, the Philippines. Hell yeah. All right. Tennessee. For those of you who are just coming in, all right, the answer to this question was A, administer IV insulin. Uruguay, El Salvador. Welcome, guys. Haiti, Jesus Christ. I feel like ludicrous over here. Got, you know, we're going to keep it appropriate, but if you know Luda, you know I'm talking about all these different area codes. All right, Mexico, Djibouti. God damn, that's the Horn of Africa. All right, let's go. All right, guys, let's jump back into it. Question 21. We are going to 60, y'all. 60 questions. Here we go. 21. Client with spinal cord injury at T4 shows a pounding headache, diaphoresis, and hypertension. What should the nurse do first? What should the nurse do first? Okay, CNCs, some B. Some A's. All right, what should the nurse do first? Here, guys, the answer here is going to be C. All right, set the client up right. All right, so C lowers blood pressure in this autonomic dysreflexia, which is what the question is trying to get at. Okay, especially with the T4, pounding headache. All right, autonomic dysreflexia. A is going to worsen the hypertension. B may be needed, but not first. All right, and D is just not appropriate. Don't do that. 22. Is that 22? Yep, that's 22. Okay. Client with COPD on 2 liters of oxygen becomes confused and drowsy. ABG, pH 7.29, PaCO2 of 70, a PaO2 of 61. What is the priority? What is the priority? All right, I'm noticing we are a little behind schedule. We should be closer to question 30 by now, since we're 30 minutes in. But that's all right. All right, question 22. answer here is going to be C, prepare for BiPAP. All right, C is going to, again, treat that hypercapnic respiratory failure because that CO2, what's our CO2 range? 35 to 45. So they're hypercapnic, they're retaining CO2 to a terrible degree. All right, COPD patients do retain CO2 at a higher level than normal patients, but that's too fucking high. All right, we need to get them on BiPAP pronto. All right, 23. Here we go. A client receiving a blood transfusion develops itching and hives. What is the nurse's first action? Thank you for the follows. Yeah, 100%, guys. This is a gimme. All right, we are stopping the transfusion. All right, B is always the first action for a reaction, especially blood. Especially blood. All right, 24. A client with suspected peritonitis following PD reports cloudy, effluent, and abdominal pain. What action is the priority? 24. A client with suspected peritonitis following PD. Okay. Yep, 100%, guys. All right, answer here is D. All right, D halts the cause of infection exposure. Okay, B is done afterward. A provides comfort only, and C is unsafe. Don't do that. All right, 25. A client with suspected stroke arrives with slurred speech and right-sided weakness. BP is 188 over 106. What is the priority intervention? What is the priority intervention here, guys? Okay. Thank you guys for answering some of the other viewers' questions. It moves so fast and I got to keep this moving. Okay, I'm seeing a lot of C's, some D's. Okay, I had this question on my 2 lives ago, and it was as confusing for you guys as it is right now. So the answer here is B, and I'm going to tell you why. So we need to obtain that blood glucose. Why? Because these symptoms that they're showing are also symptoms of hypoglycemia. All right, and so we need to rule out an immediate reversible cause of these symptoms right off the bat. So I work in the emergency department. So when a patient comes in with stroke-like symptoms, we're getting a blood sugar on these patients while they're still on the medic stretcher. So they're given a report to the doctor who's doing a quick eval. The tech or me is checking a blood sugar, just making sure and ruling out very quickly it's not hypoglycemia. Because if there comes back and the blood sugar is 26, well, okay, we need to treat that right now. Okay, so right-sided weakness is not always indicated of hypoglycemia, but when we talk about these in its totality, these signs of stroke, the number one answer, always in real life and on the NCLEX, you're going to check the blood sugar. Got it? Okay. I really need to drive that home. All right, 26. A client receiving gentamicin reports ringing in the ears. What should the nurse do first? What should the nurse do first with ringing in the ears? Yep. This is a gimme. Yep, we're going to stop. We are going to stop the medication. Okay, that's going to prevent any further, what do they call that? Ototoxicity, right? Ototoxicity. Yep, you guys got it. Motherfuck yeah. Here we go. 27. A pediatric client with suspected intussusception presents with current jelly stools and severe pain. What is the priority? What is the priority? Thank you guys for the follows. Amazing, amazing. Yep. All right. So correct answer here is going to be A. All right. We're going to prepare for an air enema reduction. So A is correct because it is the diagnostic and therapeutic intervention for inception. So B is unsafe due to the obstruction. C does not treat the obstruction, and D is supportive only. Okay, it doesn't do anything. All right, guys, if you're just jumping in, you're new to the live, go ahead and follow. We're going to be doing this every single day, Sunday to Saturday, including Thanksgiving. I'm going to be here for you to crush this fucking test. All right? Yes, keep going. If you guys are new, just go ahead and follow. Go ahead and also share so that we can get, I'd love to get over 500, 600 people. Freaking go. Yes, yes, yes. Thank you, Nadia. Welcome. Thank you. Love it. All right, 28. Here we go. A client was receiving TPN, has a blood glucose of 48. What is the nurse's first action? TPN. What is the nurse's first action? Again, right? If you're going to do one thing, walk away and never come back, which is going to be the thing that actually helps the patient. You want to treat the hypoglycemia. The answer is C. All right. So C here is going to prevent any neurological injury. It's going to address the hypoglycemia. All right. A just delays care in this instance. B may be needed, but not first. And D worsens hypoglycemia. Okay. TPN doing nothing wrong. All right. 29. A client on a PCA morphine pump is unresponsive with respiration 6. What's the priority? What's the priority, guys? What's that one thing, if you do it and then leave the room forever, would actually help the patient? Would it be A? Just turn it off? Is that going to fix their respiration rate of 6? It might. What's the priority? D's going to just be oxygen. What's going to wake their ass up? All right. The answer here is B. We are going to give naloxone, okay, otherwise called Narcan. So their respiratory drive is compromised. We have an airway and breathing problem. We need to do B. We need to give Narcan, okay? That will wake them up. It will fix the problem, all right? Likely in real life, you're doing all 3 of these at the same time, whatever gets the one first, okay? But on the NCLEX, you're going to do, this is the priority, okay? I love you. This is tough love, okay? I believe in you. Okay. All right. So, question 30. 30. Here we go. All right. A client with a central line develops an air embolism. What is the priority positioning? What is the priority positioning, guys? All right. I'm seeing C, B, D, B. I found B. I see someone yelling B. I wonder why. Well, it's because it's the right freaking answer, guys. All right. Left lateral, head down. All right. So the correct answer is B because it traps air in the right atrium. Did you know that? If you didn't, it's okay. It's okay. I promise. It's okay. All right. So A is going to worsen the embolism. C increases the risk of air migration. And D is just plain ineffective. Don't do it. I know, Raven, learn something new every day. That's why we're here. That's why we're learning. All right. And we've got a few more people in the chat. Amari, I didn't know that. Hey, that's why we're here. Okay. So, I'm Nurse Jimmy. I'm an ER nurse, and I am also going to help you guys pass the NCLEX if that's what you're doing. All right. We do PN, we do RN. All right. Just start by following, because we're going to be doing these every single day this week, every single day at 9:30 Eastern Standard Time. Go ahead and follow right now. Okay. So that's number one. Number two is share this live right here. Okay. Doesn't cost you, doesn't do anything. It only benefits us and gets more people in here, helps me out, helps the channel. So I appreciate that. Number three, in the link in my bio, I do NCLEX study plans, custom to you, your time, your resources, your weaknesses, your subscriptions that you already have. So if you're a repeat test taker, they're based on your CPR so that you can shore up those weaknesses. All right. So those are available in the chat. I'm sorry, in the link in my bio, they're $25 because I do take time to do them. I can usually turn them around in 24 to 48 hours. That's that. Also, second thing in the link in my bio is my free NCLEX Vault. Just ask for your email address. That's it. 240 pages of cheat sheets, mini tests, and a strategy guide in there on how to attack this test. All right. We are halfway through, guys. 30 questions. We're going to 60. Thank you all for sharing the lives. I appreciate it. All right, let's jump into question number 31. There it is. Let me pull this up. A client with Addisonian crisis arrives severely hypotensive, confused, and hyponatremic. What is the priority? Thank you guys for sharing the live. I really appreciate it. All right, absolutely, guys. Answer here is going to be B, because B replaces the missing cortisol immediately, and that's our main issue here. Okay, A is going to be ineffective without steroids. I see a lot of A's. All right, A is going to be ineffective without steroids. C is unsafe, and D is just supportive only. All right. Thank you guys for all the follows. If you're jumping in, just go ahead and follow. All right. Fantastic. Question number 30. I'll lose track of where I am. 32. Is that 32? Yep. Okay. Here we go. Client with aortic stenosis reports chest pain, dizziness when standing. What's the priority? What is the priority? Aortic stenosis reports chest pain and dizziness when standing. See, A, B, and C, all over the place. All right, answer here, guys, is going to be C. So C is going to prevent decreased preload and syncope. Okay, A could potentially cause fatal hypotension. All right, we don't know their blood. We don't know what their blood pressure is, so giving that could just tank their blood pressure. All right, B is long term. Okay, and D may worsen symptoms. So here, the correct answer here is going to be C. All right, 33. We should not get an ECG for, we need to address the issue here. When on the, maybe real life, some of these answers are going to be different in real life, but on the NCLEX, it's safety first, okay? Client with liver failure has a platelet count of 22,000. What's the priority? What is the priority? What is the priority? See some C's, some D's, A's, and B's. What is the priority? A priority here needs to address the issue. What's the issue? Okay. The issue is that there could be some issues like with life-threatening bleeding possibly going on. So, all right, so the answer here is going to be D. We're going to assess for bleeding, okay? Because D identifies life-threatening bleeding early. A, B, and C are correct interventions, but not the priority, okay? They're just not the priority right this second, okay? All right. I just got a banner that somebody filled out a custom NCLEX study plan. I can't see the name, but if it's you, call yourself out in the chat. All right. Thank you for doing that. We'll get this back to you in 24 to 48 hours. Thank you for the gift, Jasmine. All right. Question 34. Child with asthma is in severe distress, silent chest, cannot speak. What is the priority? What is the priority? Yeah, this child is sick. They are sick. They're in severe distress. Silent chest, cannot speak. Sorry, but an albuterol neb isn't going to help. All right. We need to prepare this patient for intubation, okay? Because we are talking about possibly a life-threatening obstruction, okay? Silent chest, can't speak, all right? A, may not even reach the airway. That's why it may not be effective. C is going to take hours to work, and D can't be performed, okay? All right, 35. Client with acute kidney injury has peak T waves and potassium level of 7.2. What is the priority? Thank you guys for all the follows and sharing the live. I appreciate you sharing the live. Thank you so much. What is the priority? 35. All right, this one, okay. Yep. So we are going to administer calcium gluconate because that stabilizes the myocardium immediately. Okay? It's not B. B does not correct the current level. Okay? We need to correct what the current level is right now. 36. Thank you for following. Haley, thank you for sharing. All right. Client with pneumonia is increasingly restless and confused. Has a respiratory rate of 32, SpO2 86% of 4 liters. What is the priority? What is it? What is it? All right. Answer here. Lots of A's. All right. Answer here is going to be B. All right. Increase oxygen to non-rebreather. All right. Because right here, B is going to treat the severe hypoxia immediately. Okay. A can be done after stabilizing the oxygenation because we have a breathing issue. We're talking about our A, B, C's, right? All right. C is supportive only. And D does not help with oxygenation. Okay? Boom. 37. Can you get a copy of the questions? I posted my last full live to my, I have to call it the YT. I think you guys know what I'm talking about. So I should post the full recording of this over there, okay? All right, 37. Yep, answer is going to be A. Good job. Good job. So here, what you should do first is A. All right, always the first line for infusion reactions like Redman syndrome. All right. B is not needed unless anaphylaxis. C can be done later, and D is supportive, but not first. Okay. The YT channel name, I believe, is Nurse Jimmy Official. All right. There's not a whole lot on there. I'm still kind of figuring out exactly what I want that to be, but I thought that more of the long form type of stuff would be beneficial. So I think I'm going to post the full lives over there so you guys can check those out. All right. 38. Client post-op day 1 after hip replacement has sudden shortness of breath, tachycardia, and anxiety. What is the priority? All right. What was that? I saw a question somewhere. Oh my goodness. Amy Blackburn, as I live and breathe. What's going on? Welcome to my live. All right. So 38 here is going to be B. All right. So B is the life-threatening diagnosis here, okay? A, C, and D are just unrelated interventions, okay? All right. Question 39. Here we go. Client with ulcerative colitis has 12 watery stools a day, heart rate of 132. What is the priority? What is the priority here, guys? 12 watery stools, heart rate of 132. All right. When we talk about priorities, think about, again, what is one thing, if you had to do one thing to the patient and leave the room and never come back, what is the one thing that would actually help the patient? Would it be get an electrolyte panel? Is that going to help the patient? I mean, all right, we're talking about 12 watery stools a day, a heart rate of 102. This patient, we need to be thinking hypovolemia, okay? That's what this question should hopefully start screaming to you when you start seeing this. So yes, we need to begin fluids. We need to begin fluids, okay? Good job, guys. Lots of you got that. Question 40. A child with croup has stridor at rest and retractions. What's the priority intervention? What's the priority intervention? I see some A's, B's, D's. The majority of you. TikTok is saying that you're saying B. Man, you guys are firing away. Yep, right. So the answer here is going to be B, that racemic epi. Why? Okay, racemic epi decreases airway swelling. Okay, and it does it quickly. So A, you're only going to do that for mild cases. C is unsafe, right? And D can worsen the obstruction. We're never going to put anything in their mouth. So the answer here is D. All right. All right. So just for a couple new folks, we've done another 10 questions. We're going to 60, so stay here. All right. But if you haven't already, go ahead and follow the live. All right. We're just going to be doing this every single day, Sunday to Saturday, including Thanksgiving. Okay. We'll be here doing these questions, at least 60 of them. All right. And then throw some likes on the screen because it helps boost the live up into the people's for you. All right. And then, all right. Then also share the live. All right. All those things really help me out and I really appreciate it. That said, the link in my bio, I do custom NCLEX study plans. They're based on you, your resources, your time that you have available. All right, so check those out. And then also the NCLEX Vault, which is entirely free. Just ask for your email address. 240 pages of cheat sheets. All right, let's go, guys. Let's jump back into it. 41 is a client with suspected GI bleed. Has a heart rate of 128, BP 86/54, pale skin, and melanoma. What is the priority? What is the priority here? So they're GI bleeding, they're tachycardic, hypotensive, pale skin, melanoma, so they've got blood coming out their butt. All right, yeah. Right, guys, it's B. We need to start 2 large bore IVs here. So B is going to allow for rapid fluid and blood administration. So A would follow after stabilization. C can be done after IV access. D is important, but secondary. Okay? 42. All right, client with preeclampsia is receiving mag sulfate. Which finding requires immediate action? Man, we are behind today. That's all right. I'm gonna need to grab a charger for my phone here in a second. All right, question 42. Answer here. Oh my, you guys are lots of D. All right, but majority of you picked B here, which is the correct answer. All right, B here indicates magnesium toxicity. Okay, so that's what we need to be thinking about. A, C, and D are all acceptable. Those are all normal things. Okay? 43. All right, give me the answer to this. I'm just need to grab a charger from my cabinet. Keep going. Let me see those answers. All right. No luck. All right. So 43, we are going to be doing A, slowing the infusion. All right. So A is going to prevent any fluid overload progression. B is maybe a little premature. C, only if the overload worsens, and D should be done after rate reduction. All right, 44. A client taking clozapine reports fever and sore throat. What should the nurse do first? What should the nurse do first? Whew. What are you guys drinking on right now? I got a little scotch here. Okay, 44. Yep. Majority of you are saying C, which is the correct answer. Good job. All right, C is we're gonna hold the medication due to the risk of agranulocytosis. Okay, that's what they're getting at here. Agranulocytosis. B can be done afterward. A is not a priority, and D is supportive only. All right, 45. Client with acute pancreatitis has severe lower quadrant pain, left upper quadrant pain, and elevated amylase. Which order is the priority? Which order is the priority? All right, majority of you are saying A, which is correct. All right, A is going to prevent any further pancreatic stimulation. B is going to worsen the inflammation. C Opioids should be done IV, and D is contraindicated. All right. Let's see. Oh, we've got over 500. Let's go. Go ahead and share this live, guys. Let's keep it going. We've now reached our goal here. All right. Of 500. Let's keep it going. Thank you guys for all the likes. You guys are freaking amazing. Thank you for the follows. 46. All right. Client, post-thyroidectomy, has difficulty speaking and increasing neck swelling. What is the priority? What is the priority? Hey, Sid! Really need a phone charger. Really need a phone charger. Okay, 46. 46 is going to be C. Okay, assess airway and prepare for trach. All right, because C indicates an airway obstruction from a hematoma. B is helpful but not definitive. A is not a priority, and D is unrelated to airway. Okay. Hell yeah. Let's see, 47. Here we go. A client receiving nitropside infusion becomes confused with bright red skin tone. What does the nurse suspect? 47. What does the nurse suspect? All right, I'm seeing majority of you are saying D. However, the answer is B. Okay, so cyanide toxicity. So nitropside metabolism can produce cyanide. Okay, A, C, and D just do not fit the picture here. All right, 48. Client with suspected DVT has unilateral leg swelling, warmth, and pain. What is the first action? All right, guys. Keep answering. I gotta grab my charger from my bedside table. Okay. All right, I'm back. All right, you guys are, sounds like you guys are killing it. Okay. All right, you guys are, sounds like you guys are killing it. Okay. Okay. All right, so question 48 here. The correct answer is going to be B, elevate the leg. All right, because it's going to reduce swelling and discomfort. A and D are just unsafe. C is outdated and dangerous. Okay, 49. All right, a client with SI-ADH has a sodium of 118 and confusion. What is the priority? What is the priority here, guys? Thank you guys for all the likes. If you haven't already, go ahead and follow. We'll be doing this every single day, Sunday to Saturday, including Thanksgiving. All right. Yep. I'm seeing lots of C's here. However, the answer here is going to be B. All right, so the answer here is going to be B because it will rapidly increases the sodium to prevent seizures. All right, and so with the sodium of 118, and we know normal sodium is what, 135 to 145, we need to rapidly increase that sodium. All right, so that's why B is going to be when your sodium is low, sodium affects the brain, whether it's low or high. It's going to dehydrate the brain, which could cause seizures, right? A is correct, but slower. C is important, but secondary. And D is just supportive. So B is the most correct answer here. Okay, that is the priority. It is the thing that will help the patient the most. Okay, fantastic. Good job, guys. Question 50. All right, a client with hypovolemic shock receives 2 liters normal saline but remains hypotensive. What is the next priority? All right, just got another custom study plan order. Thank you. I can't see who sent it, but if it's you in the chat, go ahead, call yourself out. Thank you very much. We'll get that back to you in 24 to 48 hours. Link in the bio if you want a custom study plan to get you through this NCLEX. It is a bitch, and we will get you there, okay? I say we, there's not a team here. It's just me. All right, 50, baby. Let's do it. All right, so here's the answer. What's the next priority? The answer here is going to be A, okay? We are going to administer those vasopressors because here it's going to support the MAP after the fluids fail, okay? B is unsafe, C worsens shock, and D is not recommended, okay? So, yeah, that's why. So we are going to administer vasopressors there. All right. That is the next priority. Question 51. We're going to keep it going because I like the momentum in how fast we're going. Guys, if you haven't already, just go ahead and follow. I really appreciate that. We're going to be doing these Sunday to Saturday, every single day at 9:30 Eastern Standard Time. You can register in my story, and TikTok will send you a notification when I go live. Also, just go ahead and share this live. All right? You guys are doing great. You guys are really doing good. Okay. Question 51. I'm seeing lots of B's, which is the correct answer here, guys. Fantastic. The priority here is going to be B. All right, because giving that lorazepam is going to prevent seizures. All right, and the delirium tremens, which is what we're concerned with here when we're talking about acute alcohol withdrawal. Okay. All right, 52. We have 8 more questions left. We're going to 60. A client with necrotizing fasciitis presents with fever, severe pain, out of proportion, and hypotension. What is the priority? I'm paging the doctor. All right, 52. What is the priority? All right, seeing majority of you are saying B, which is the correct answer here, okay? Because administering those broad spectrum antibiotics will treat that life-threatening infection. Neck fascia is no joke. It needs surgical intervention. Okay? Fantastic. All right, 53. All right, client with a new trach has bubbling at the neck site with increasing subcutaneous emphysema. What is the priority? What is the priority? All right. Man, you guys have been studying. You guys have been studying. Hell yeah. Yeah, generally, if there's questions about administering a med, you generally run with the assumption that there's an order for it. Yep. All right, 53 is going to be C. assess for airway obstruction, because C checks for any dislodgement or obstruction, which could be a major emergency, obviously. A is just insufficient. B is secondary, and D does not fix the issue. All right, 54. A client in labor has recurrent late D cells. What is the priority? All right, late D cells. You guys remember the acronym? What's the acronym, guys? Somebody call it out in the chat. Come on. What's the maternity? There it is. Oh, hell yeah. Veal chop, okay? The L is the late D cells. The P is the placental insufficiency, right? Okay. Fantastic. All right, so 54 here. Yeah, we're going to position the patient on the left side because it's going to improve that placental perfusion, right? Okay, A is going to worsen the D cells. C is for variable D cells, and D is just not the first step. So, boom. Thank you guys for the follows. If you guys haven't already followed, go ahead and just follow on up there. We're going to be doing this every day this week, Sunday to Saturday, including Thanksgiving. Yes, get in there. Follow, follow, follow. We're going to be doing this. And I hope you guys found this helpful. All right, 9:30, Persian, honey. We're going to be doing this 9:30 Eastern Standard Time, United States, 9:30 Eastern Standard Time every single day this week. All right. All right. Question 55. A client with pericarditis reports pain that improves when leaning forward. Which finding is most concerning? Which finding is most concerning? Okay. A, B, C, 10 of you, 12 of you saying C. All right. All right. So the majority of you are saying C, which is the correct answer here. Okay. So C, those, which finding is most concerning? It's going to be those muffled heart sounds, because here with the symptoms that the patient's showing, C does suggest cardiac tamponade. All right, A and B are expected with pericarditis, and D is typical and not the emergency. Okay? Yep, Navy got it. C, cardiac tamponade. All right, 56. There we go. 56. All right, a child with sickle cell crisis presents with severe pain, swelling in the hands and feet. What's the priority? 56. Really good, guys. Really good. Yeah, answer is going to be B. That is what the majority of you are saying. That is the correct answer. We are going to provide IV opioids because it treats the acute vaso-occlusive pain that occurs during sickle cell crisis. All right, these patients are in so much pain. I feel so bad every time I have a sickle cell patient, and their veins are shit. So yeah, it's hard to get an IV. But yeah, when you do, you're going to give those IV opioids. All right. Almost done, guys. 57. Here we go. A client after abdominal surgery develops sudden wound dehiscence with visible loops of bowel. What should the nurse do first? What should the nurse do first? Okay. Yep. All right, the majority of you, it appears, are saying A. So yeah, that is the correct answer here. So what should the nurse do first? We should cover with a moist, sterile dressing, because what is it going to do? It's going to protect the organs and prevents drying. Here, B is contraindicated. C is not appropriate. And D can be done afterward. Okay? All right. So we're getting to the end, guys. If you haven't already, go ahead and follow. Again, we're going to be doing this literally every day, Sunday to Saturday, at 9:30 Eastern Standard Time. All right. Yep. Fantastic. And yes, Scotch indeed, my friend. All right. So here we go. 58. A client taking lithium. Lithium is such a high yield topic on the NCLEX. All right, client taking lithium has vomiting, diarrhea, and tremors. Lithium levels 2.2. What is the priority? Lex has wine over there. All right. What else do you guys got in your hands while you're studying? All right, 58. Okay. So here, guys, the answer here is actually going to be B. All right, the majority of you are saying A. So A is needed, but it's not the priority. Okay. Here, the priority is going to be administering IV fluids. And I'll tell you why. Because here, it's going to help enhance the lithium excretion and correct the dehydration, which is driving the toxicity. Okay? It's going to enhance lithium excretion and correct the dehydration, which is driving the toxicity. Okay? Yes, A is needed, but it's not the priority. They're both correct, but B is more correct. Oh, love it. Love it. Okay, yep, and then C is rarely required and D is just insufficient. Okay? Yep, very tricky. All right, 59. Here we go, a client with burns over 45%, all right, of the total body surface area has a urine output of 12 mLs an hour. What is the priority? What is the priority? All right. Yep. Okay. I'm seeing the majority of you are saying A, which is the correct answer. So yes, we are going to increase the LR infusion because it's going to treat that inadequate fluid resuscitation. B is already expected. C does not address perfusion, and D is supportive only. Okay? All right, guys, we're getting towards the end here. If you haven't already, go ahead and follow the live. We're going to be doing this every single day, Sunday to Saturday, 9:30 Eastern Standard Time. So, yes, follow. Thank you very much. Question 60. Here we go. A client with acute ischemic stroke arrives within 45 minutes of symptom onset. What is the priority? I feel like we're ending it with a gimme here, guys. But let's go. Let's see. All right. Ooh, you guys are mixed. Lots of A's. What is the priority? So here it goes in a very sequential process with the strokes. And first thing we need to do, the first priority with this situation is B. We need to get a non-contrast CT, okay? Because what is the biggest issue with strokes. We have two different kinds of stroke, right? We have ischemic and we have hemorrhagic. Okay, and that non-contrast CT is going to tell us what type of stroke we have. So if you just go all willy-nilly and start throwing TPA in your patient and you don't know what kind of stroke you have, and you say, well, and you find out you have a hemorrhagic stroke and you give TPA, that patient's dead. All right, we need to find out what that stroke is first. So is it an ischemic, meaning a blockage, or is it a hemorrhagic stroke? So we need to prioritize that non-contrast CT. All right, blood pressure, that's normal. Give aspirin, that's later. Priority here is get that non-contrast CT. All right. All right. I'm going to drop this down. Okay. All right, guys. So there's 530 of you in here. Amazing. Thank you guys so much for joining. If you guys haven't already, again, we're going to be doing this Sunday to Saturday. Go ahead and follow. We will be doing these literally every single day, Sunday to Saturday, and then I'll have more of a regular cadence. On top of that, thank you guys for following, and I appreciate you. So here is in the link in my bio, if you want a custom NCLEX study plan that is tailored to you, that basically it focuses on your weaknesses. If you're a repeat test taker, it uses your CPR. And I take that into account to make sure the plan shores up your weaknesses so you come back to the test more prepared your second time around or third time around. I took the test twice. Okay, it happens. It takes into account your resources, the subscriptions you have access to. So check that out. It's $25, but that's just because of the time it takes me to do it. And I can turn those around usually in 24 to 48 hours. Okay. So there's that. There's also the link in my bio that has the NCLEX Vault, which is 240 pages of cheat sheets. And after each section, there is a mini question, a 25 question mini test after each section. So check that out. All it requires is your email address. I hope that you guys found this helpful. It seems like the feedback overall when I do these lives has been pretty positive. So thank you very much. All right. So the question, no, I saw your comments. So the question did show up a little, that it did say ischemic in the question. Basically, you're still going to get a non-contrast CT. If it hasn't been done, it's got to be done first, period. Okay? That's your order of operations when it comes to stroke management. So you need to get that non-contrast CT. All right? You're never going to, your patient arrives and you're just going to throw TPA in there. All right? It's super, super dangerous. If there's an option that suggests you haven't already gotten a CT, you're going to get a CT. All right. So I apologize. The question was confusing. I'll give you that one. It was a little confusing. But a lot of NCLEX questions are confusing. All right. So I feel like that's a conversation that I've had with a nursing instructor before. It's like, wait, but the question said an ischemic stroke. Yes, but you're still not going to throw TPA in a patient without getting the CT if it's an option. So, I'm not ignoring you. I saw your comments. I just needed to get my little spiel out. All right. Yes, you're welcome. Thank you guys. 250 in here? Hate, it is getting late Sunday night, but if you haven't already, go ahead and follow. I try to answer as many DMs as I can. So if you have any questions, shoot me a message. If you have any questions about the study plan, go ahead and message me about that as well. Happy to, hammer out any worries or anything that you have before you throw $25 at something. But I can tell you, the pass rate on that is high. So we've been fortunate, and I'd say the majority of people who are using the study plans are repeat test takers. There's quite a few who aren't, but kind of it's when you're studying for this test, and from my experience, you kind of seem overwhelmed with the resources and how to study. So the study plan takes the guesswork out of it. It gives you a daily schedule, so Monday to Sunday. So it tells you, and I'll show you how to incorporate all of those things, your time that you have available, your resources, your weaknesses, your CPR report, and put it all together into one plan so that you come back at this test stronger. Okay, so again, that's through the link in my bio. All right. So this is, Bill, this was mainly, I'd say the majority of this applied to RN primarily. LPN, when we talk about some fundamentals, some delegation, that stuff can still apply to LPN. How can the study guide? So the study plans are available in the link in my bio. Go to my profile page, go to the link that's below my picture, click on it. There's a link there that will take you to fill out a form, put in the information that's required, and that'll help me tailor that plan more specifically to you. Okay? All right, thank you guys for the follows. If you haven't already, before we jump out of here, just go ahead and, if you haven't already, go ahead and follow so that you're in the loop and ready for the next. We are going live tomorrow at 9:30 p.m., same as tonight, and we're going to be doing it until Saturday, November 29th. All right, so 9:30 p.m. Eastern Standard Time. Meet me here for at least 60 questions. Okay? I really appreciate you all coming in, chiming in, being active, chit-chatting. But I've got work tomorrow. I am a working ER nurse, and it is time to get the hell out of here. So thank you guys. Until next time, have a good one. You're welcome.